Next speaker is Dr. Jaleesa OP, presenting on pattern of dry eye associated with face mask use during COVID-19 by OSDI score. Over to you.
Good morning. My paper is on pattern of dry eye associated with face mask use during COVID-19 by OSDA score. Introduction. Dry eye is a multifactorial disorder of ocular surface characterized by symptoms of discomfort, visual disturbances, tear film instability with a potential damage to ocular surface. Emergence of COVID-19 pandemic resulted in widespread use of face masks, and there is marked increase in dry eye symptoms among regular mask users, that is known as mask-associated dry eye disease or MAID. Face mask can cause dry eye due to many mechanisms like the increased airflow probably hastening the evaporation of tear film, causing ocular surface irritation and inflammation, and increasing carbon dioxide inside a face mask could result in changes of the corneal nerve sensation and induce inflammation. Objective: to study the pattern of dry eye associated with face mask in patients presenting with the symptoms of ocular irritation. Materials and methods. Study design is a cross-sectional descriptive study, period over 12 months, and study population, patients attending OPD wearing mask and having symptoms of dry eye. Study tool is a structured proforma, including ocular surface disease index questionnaire. Sample size is calculated as 285. Inclusion criteria: 18 to 65 years of age, wearing mask and having symptoms of dry eye. Exclusion criteria: other causes of dry eye and patients with symptoms of dry eye for more than 1 year, and patients who are unable to comprehend the OSD questionnaire. Study procedure: patients are selected by random sampling, informed consent taken, and OSD questionnaire is used to classify the patients into normal, mild dry eye, moderate dry eye, and severe dry eye based on the OSD scores. It is a validated questionnaire having 12 questions under 3 subscales. And this equation used to calculate the score, and the subjects are classified into various groups for analysis. Results: distribution of population based on severity of dry eye as per mean OSD score. 52% had dry eye and 48% were normal. Among all these, 15.1% were mild, 33.7% was moderate, and 3.5% was severe dry eye. And based on type of face mask used, 74% used N95 mask, 23% used triple layer mask, and 3% used cloth mask. Based on type of face mask used and dry eye status, none of the cloth masks had dry eye. 50.2% of the N95 mask users and 67.2% of the surgical face mask users had dry eye. Based on hours of face mask usage, 56% used it more than 8 hours and 44% used it less than 8 hours. And based on dry eye based on the hours of face mask usage, it was more among those who used it more than 8 hours, that is 75.6% in 8 to 12 hours and 71.6% in more than 12 hours. Based on age groups and dry eye status, it was highest among 31 to 45 years, that is 73.5%, and none above more than 60 years had dry eye. Based on gender and dry eye status, male to female ratio of the population was 56.1 to 43.9, and 50.4% of the males and 53.8% of the females had dry eye. Discussion: by comparing with some previous studies based on prevalence, a study of Laura Bagoda in 2020 showed that 18.3% had mask-associated dry eye. The higher prevalence of dry eye in our study, that is 52%, may be because it was conducted a bit later period of COVID pandemic, when the use of face mask might have considerably increased. And based on the type of mask, by a study of H.S. Shalaby et al., he compared surgical face mask and N95 mask, and surgical mask had a greater drying effect compared to N95, and this was consistent with our study. And based on duration of face mask wear, by study of Zakaria et al. On 67 subjects, he found that those who wear face masks for at least 6 hours per day, 5 days per week, showed a higher incidence of their OSD score as compared to standard users. And by study of AIMS Hyderabad in 2023, among 114 healthcare workers, using OSD questionnaire, wearing mask more than 3 to 6 hours per day contribute to worsen symptoms of dry eye disease. This was consistent with our study. And conclusion: significant increase in prevalence of dry eye in subjects using face masks. The type of face mask used and chosen to wear also play a role. Severity of dry eye disease increased with the increase in hours of face mask usage. Using a better type of mask that is tighter at the nostril, decrease the frequency of mask use may prevent development of MAID. may increase compliance to the use of face mask also. The limitation of the study, the diagnosis of dry eye disease and information about duration of face mask was purely subjective, and lack of objective monitoring of the study subjects regarding method of mask use and proper sealing, and dry eye caused by use of digital screen which had equal relevance was not explored in this study, and other factors influencing dry eye like environmental information were not taken into consideration. My references. Thank you.
What's the reason for this onset of dry eye in these patients?
Because the airflow into the eyes, and the warm air, exhaled air into the eyes can cause dry eye due to evaporation of the air.
Did you find out the Meibomian gland functions and all in these cases? Any reason could be associated with the Meibomian gland dysfunctions?
No, sir.
That means all surgeons will have, no? Suppose we are doing cataract surgery and all, we have been washing face masks, all of us will be having dry eye then. Then for us, what face masks do you advise? Surgical face mask or N95?
I'll be advising N95 mask as it has more approximation and less airflow towards the eye.
Because you are using daily, no? Face masks and all.
Yes.
Okay, thank you.
Thanks.
Here is it. Your other studies also showed that N95 is having less effect, no? Why that N95 is having less dryness compared to the surgical mask?
N95 have more sealing than surgical face mask.
Yeah.
So the airflow into the eyes will be lesser compared to the surgical mask.
So this study, you have asked a questionnaire, no, about how many hours they uses. Did you ask the question whether you are using over the nose or over the mouth? So
No.
the duration can totally will vary. And another this thing, because when I used to use this one, I used to tape it here. So that means there won't be any dryness, no?
And
If I drape it here with a plaster, this dryness will disappear, no? Are you correct?
air for the sticking
Airflow won't come, no?
Sticking of the paper on the lower eyelid will change the position of lower lid also, and mechanical lag of thermal.
That is the reason you explain that N95 is having less dryness because it is sealing better. Okay, if you seal it totally, like sir asked, when you are going into the